But first, I want you to meet Dr. David Strain, who's going to lend his expertise throughout this episode. He's a member of the NHS Long Covid Task Force. David, welcome to Inside Health.
Thank you.
I suppose we should just start off by just saying what technically counts as long COVID?
The technical definition of long COVID is any ongoing symptoms beyond 4 weeks, which is ongoing COVID, and then post-acute COVID syndrome starts at 12 weeks onwards.
And when we're talking about symptoms, what are the most common?
There's a range of symptoms, and actually a lot of this is dependent on what type of long COVID you've got. There are many people who've got long COVID that is the hangover, for want of a better term, of a very severe illness. As you would imagine, if you'd spent 2 weeks on ITU being ventilated, then that will leave some damage that takes a while to recover from. For those people, shortness of breath, difficulty breathing is a key element. However, the long COVID that tends to be more spoken about is the fatigue, the brain fog, difficulty focusing to the end of a sentence in some cases, let alone an entire program, and then muscle aches and pains. There are then a whole host of other symptoms that can be tied in. So some people will experience hair loss, fevers, night sweats, diarrhea, or profound constipation. But most of them are associated with one of those three elements of fatigue, brain fog, or the muscle aches and pains, myalgia.
And David, how big a problem is long COVID? Because I will speak to some people who will barely acknowledge that long COVID exists, and others who would almost say that every single person in the country has long COVID. Where's the truth?
The truth is likely to be somewhere in between. There are many people who experience COVID, had a very, very quick, very good recovery. There are other people who have been profoundly affected with this, even colleagues of mine who are working in hospital, who've gone from running marathons down to, in one particular case, he's now wheelchair dependent because of the extent of the muscle pains, the fatigue. When it looks at those who've got symptoms that are disturbing their quality of life, it's about 10%, just under 10% of the fully vaccinated population that are left with ongoing symptoms that they do report to us is impacting their quality of life. And therefore, I think that's probably the number that we need to be looking at.
Now, during this episode, David, we're catching up with John, Neil and Joe, who all had long COVID symptoms a year after they were infected, and we're catching them now 2 years on. How unlucky are they?
Unfortunately, this is a picture that we're seeing more and more of, that people who had their symptoms at 12 weeks, at least half of them are still got symptoms at 12 months. There's currently about 2/3 people in the UK who've had the symptoms beyond 12 months. What we don't have a handle on yet is how many of those patients are going to end up with conditions that continue beyond it. And if we start looking at other post-viral syndromes, and ME, myalgic encephalomyelitis, is widely accepted to be one of these, many patients are left with symptoms from that for years, if not decades afterwards. And this is a thing that we don't have a handle on yet.
Now, in last week's episode, I asked if you had any questions about long COVID, then email in and we'll try to answer them. And overwhelmingly, the biggest question from people like John, Carol, Helen, Barbara and more was, is chronic fatigue syndrome /ME the same thing as long COVID? Is this the same disease?
It is too early to be certain, but all of the preliminary studies that are starting to come out are highlighting more and more similarities between them. For example, the antibodies that protect you against the virus, there's a particular pattern that is associated with long COVID, and that is also associated with ME, myalgic encephalomyelitis, chronic fatigue syndrome. There are many, many symptoms that are the same, and actually even the trajectory appears to be the same. All likelihood, ME and long COVID are the same family of conditions with a different underlying trigger, and therefore there's much that we can learn for long COVID from the ME community, and hopefully much that we'll be able to learn for the ME community as all this research takes place in long COVID.
And David, question from Anna Hipkiss. Can you get long COVID from the Omicron variant? And I think that's a really clever question, because we know some of the biology of the virus has changed. It's infecting different parts of the lungs. Some of the ways it's getting into cells have subtly changed as well. So are we still getting the same long COVID from Omicron as previous variants?
It's too early to be certain. Remember, the Omicron variant was only first described just 3.5 months ago. And what I would say is the symptoms that best predict the progression to long COVID are actually the muscle aches and pains at the time of initial infection. It's the headache at the time of initial infection. And we are still seeing those symptoms with the Omicron variant. So my best guess is, yes, it will still cause long COVID, although probably not to the same extent that we saw from the Delta variant.
Now, one of the big things that Neil really wanted us to get to the bottom of is what's the virus done to his body that means he's still suffering 2 years later?
So that is a very familiar story that Neil's just told us, and this fact that he could get better and then seems to get worse is actually all part of the clues that's helping us to track down what the underlying cause is. There's 2 or 3 pervading theories at the moment. One of them that is getting most traction is that the virus itself is still hanging around in the body, away from the immune system, most likely in the gut. It's not getting into the blood on a regular basis, and when it does get into the blood, it doesn't get high enough to trigger any tests. You're not going to test positive on a lateral flow test or a PCR test. But it is just leaking enough virus in the blood that every so often you're back to the beginning again. You're back to experiencing that flu-like illness, that fact that you are exhausted for no apparent reason.
So, David, you mentioned there were a couple of ideas for what could be causing long COVID. So still being infected is one of them. What are the others?
One of them is that there's been some permanent damage to the mitochondria of your cells when you're infected. So the mitochondria, they are the powerhouse of every single cell. It's generating the energy you need to do any sorts of activity. And when the virus is getting into the cells, it uses the pathway that stimulates production of mitochondria. There are people who are suggesting that the virus itself makes those mitochondria go dormant, which is why we run out of energy much quicker in the fatigue and in the brain fog.
The other thing I've heard of, David, is microclotting.
Exactly the third I was going to come on to. So we know that COVID caused small blood clots to form within the capillaries, the very, very small blood vessels within our body. If those very small blood clots are blocking up those capillaries, the body can't get the nutrients to the tissues that need it, and probably more importantly, it can't get rid of the waste products. And that would account for why some people start the day feeling great because the body's had time to replenish itself, but very, very quickly they become exhausted. It also accounts for why people can do some exercise but take 2 or 3 days to recover from it, this post-exertional malaise that people talk about, because those toxins build up and they're just not clearing at the normal rate.
Now, I remember when we made the programme a year ago, one of the discussions was around maybe fighting COVID has left some kind of legacy in your immune system. It's just a little bit too hyperactive.
That was one of the considerations that we had there. Is this generating an autoimmune disease? But actually one of the suggestions that that's not the case is the fact that people with long COVID seem to be getting better from vaccination rather than getting worse. If it was an autoimmune disease, immune system ramped up, you may expect vaccination to make it worse rather than better.
And David, what might be causing brain fog? Because that is a really common symptom that lots of people are reporting.
Brain fog can be caused by several different options. One of them is if your brain just isn't getting the energy that it needs, and therefore you can't think clearly. But what's interesting is that report that came out from Oxford relatively recently suggesting that the brain has actually shrunk in people who've experienced COVID. So this is a study that they happened to have a series of MRI scans on the population, and they called back people who'd experienced COVID and compared before and after. So there is a possibility that brain fog is nothing more than lack of energy to the brain, but there is a concern that this actually does represent some significant brain injury caused by the virus.
David, you've mentioned quite a few ideas. Just so that I'm clear, are these rival ideas for what could be causing long COVID, or could it be each individual patient might have a different cause of their condition or may have multiple causes of their condition?
The fact that we are seeing so many different presentations means that there is almost certainly multiple different causes.
Does it make it a nightmare to treat, though, if there could be lots of different causes and you can't just assume that what's going to work for patient A is going to work for patient B?
Absolutely, and it is very, very likely. And again, we've seen that in ME. There are several treatments that we use in ME that work really well for some people and have no benefit at all for others.
So the first thing that might be the easiest is if people still have an active and ongoing infection, can you give them antivirals or vaccinate them again?
There's two different studies that are underway for that. There's one in the States that's looking at the antiviral. We're looking at starting a study very soon, which is going to be given recurrent boosts of the Moderna vaccine in our particular case. And of course, the other thing to look at is the immunoglobulins.
So these are the laboratory-made antibodies that you give to people?
Laboratory-made antibodies that we'd give to top up the immune system, particularly for those whose vaccine wouldn't have worked as effectively.
David, I was really struck by what Jo said. She says she gets frustrated, then tries to push herself, but is completely floored by it. And this has become really controversial in another related field, because if you look at chronic fatigue syndrome or ME, then should people be pushing themselves or pacing themselves is incredibly controversial. So what should people do?
It is a very controversial element, and a big part of that is because the natural response of people when they're feeling fatigued is trying to exercise their way out of it a little bit more every day. Now, there are some people that has worked for. But what happens with a lot of people with long COVID, and one of the hallmarks of chronic fatigue syndrome, ME, is that you get post-exertional malaise. So it takes much longer to recover from exercise than the benefit that you get from exercise. And that's probably because they're not clearing the waste products properly. It's one step forwards, two steps back. So for those people, we recommend they identify an energy envelope. Now, for some people, that could be walking a mile. For other people, it could just be standing up for 10 minutes to peel the carrots to make dinner. And whatever their envelope is, make sure they don't go beyond 80% of that before they take a rest. And therefore, they can do lots of very small bits of exertion without ever getting to that phase that they feel absolutely exhausted and do themselves harm. Now, one of the key components in that, though, is that it is an energy envelope that covers both physical and mental exercise.
So in terms of the brain fog, do you need to have a cognitive limit on how much thinking you do?
That is something that we are recommending for our patients at the moment, and it does involve switching your brain off. And remember, just simple things, just listening to this show will be exercise to the brain for many people. So it's trying to find some way of isolating from all mental activity in order to get the brain to recover between bouts of mental exertion.
Crikey, thank you for saying that Radio 4 is contributing to long COVID, David.
Contributing to the intelligence of the nation, and therefore it is seen as work for some, he says, struggling to dig his way out of that.
We had an email in from Colin, who lives in Worcestershire, and he says that he's having problems both with his sense of smell, sleep and memory since having COVID, but he's feeling he's not getting enough support from his doctors. What should he do?
Part of the problem is the GP, your hospital consultant even, is unlikely to know what the right treatment is because nobody knows yet. And it does leave people stumbling in the dark. There are many patient support groups, things like the Long COVID SOS, the advocacy groups that will help get in touch with them and join in with what's going on. There will be lots of people who've lived through this and can make better recommendations than your doctor because they can tell you what's worked for them. The last thing is to remember everybody with this is different. So please don't give up hope if the first thing you try isn't successful. There are many other things that we can look at in the future.
David, are there new treatments on the horizon?
Absolutely. All of the clinical trials that are underway, I mean, the study that we are starting it today locally, we will be repurposing existing drugs to treat long COVID, things like anti-inflammatory drugs that damp down the immune system or anticoagulants that prevent the clots forming. There is a massive interest commercially, internationally, in developing focused treatments to actually cure the underlying cause in the near future. So there is hope on the horizon.
Thanks to Dr. David Strain and to you for listening to Inside Health with me, James Gallagher.